Good Cathaoirleach, and good afternoon to everybody. Thank you for coming in. I want to start by stating that I firmly believe that the key issue, if not the cause, of a policy that worsened the impact of COVID-19 in our nursing homes was the policy decision taken in the 1990s to contract out the care of our elderly to private for-profit nursing homes. And I believe that some of the points made by the expert panel and in other reports backs up that view. The fact that we have 80% of all beds in the private sector, and that in that sector we see long hours of work, precarious employment, low pay, as well as a skills shortage and a push to cut costs. That's why we saw the early use and restrictions around PPE, etc. And this, combined with a failure of medical care and clinical governance, all worsened the impact of COVID on the nursing home sector. And I believe that this, as well as other issues that arose during the crisis, such as the lack of testing, etc., laid the basis for the disaster. And therefore, I have a few questions. I want to ask them together, so maybe you would take note, and there's 4 questions. The first one I want you to comment on is the call by relatives and loved ones of those who lost their lives, as well as advocacy groups of those who lost their lives in the nursing home sector, for a full public inquiry into the deaths in nursing homes, because many of us feel that this report from the expert panel, although it is welcome, is not what is needed. The second question is to look for assurance that the staff in the nursing homes have access, all staff have access to a functioning sick pay scheme, so that we don't have concerns that sick workers may feel compelled to continue to work if they're unwell. And can you also tell us if you know that the use of agency staff is still as widespread as it was, and agencies in general in the nursing home sector are being used widely? Can you tell us, my third question, and this is an important one and probably for Mr Walsh, who was it that changed the regulation referred to on page number 96, chapter 7 of the expert panel report, that specifically meant that it was no longer a requirement for the person in charge to have a registered nurse qualification or a qualification as a gerontologist on site in these homes? What do you think the purpose of that change and the consequences of that regulation change were when it came to the pandemic and to elderly care? And finally, will you comment on the recent view expressed by Philny Hay of the Irish Nurses and Midwives Association, our organisation, that we don't in fact need an audit of the staffing rations in the sector? We already know that the staffing problems are bad and we know how to address them. Specifically, how would it help to have a regulated and mandatory staffing ration and skill set, as well as a sector-wide pay and conditions applicable across all nursing homes and elderly care? So there's 4 questions there, and I'm spouting them out together because otherwise we might run out of time. Thank you.
I might start, and then I'll hand over to my colleague Niall, and I'll hand over to the HSE then. Firstly, in relation to those individuals who have lost loved ones in homes, I think all of us understand how difficult and how hard these last number of months have been. We are particularly committed to the recommendation within the expert panel report to build the advocacy services and ensure that those individuals, those families and those residents have access to professional advocacy, as we have been seen as being provided through SAGE and through the patient advocacy service. It is available across our acute hospitals, and we're working to extend that out into the community as well. In relation to the staffing, we are committed, and the Chief Nurse within the department has commenced the implementation of the Safe Staffing Framework. I'm not sure. So the Safe Staffing has been, the Safe Staffing Framework Phase 1 has been in acute hospitals, Phase 2 in the emergency department, and Phase 3 now is in older people settings. Significant learning across older people and the staffing, evidence-based in relation to staffing and the care needs of those older people is now being progressed through a draft guidance framework, which the HSE, and that is going to be looked to be tested over the next number of weeks with a view to having that guidance available for the winter period in relation to safe staffing. I might pass over to my colleague Niall in relation to the regulatory piece there that was raised.
Sorry, before that happens, Ms McClellan, thanks for the response. There was a direct question asked by the member in relation to the department's view on whether there should be a full public independent inquiry. And I know that you referred to other matters, but I think that was a very distinct, very direct question that maybe deserves a distinct response. If you could respond to that, please.
In relation to the question raised, what the department considers at the minute is that HICWA is the independent statutory authority. It is on the ground in many of those nursing homes which have been significantly challenged and where relatives and residents.
I think we're all aware of the role of HICWA. I just need to press you on that point because I think it was a fair question that was asked. Either the department supports a full independent inquiry into what happened in nursing homes during the pandemic or not. So it's a very clear question. You may not be in a position to answer it, but if that's the case, maybe just say that we're all aware of the role of HICWA. So I think it's a direct question that deserves a direct response. Thank you.
Well, in relation to what I can say has to be in relation to awaiting the various inspection reports from HICWA and progressing the patient advocacy service in relation to supporting those individuals and those residents. HICWA does have significant powers here in relation to the review of the care in relation to its inspection reports and the examination of the care and its meeting of standards. And indeed, actually, HICWA has powers in relation to, should it decide to do an investigation, it has powers under Section 9 of the Health Act.
If the HSE want to respond to those other issues, I'll have to move on then, unfortunately, to our next.
Yes, Chair, as quickly as I can. In relation to agency staff usage, agencies certainly do have a role in supplying staff right across the system, but acute, subacute HSE and the private sector. But the task really and the ask has been to ensure that we do not have agency staff moving from one location to another, and that has been an essential plank in trying to reduce the risk of transmission. In relation to assurance in relation to sick pay scheme in nursing homes, I cannot give that except in relation to HSE operated or funded services. I can't do so in relation to the private sector. And I can confirm that I had no act or role in relation to altering the qualifications required to be a person in relation to Ms Hayes' comments in relation to safe staffing, I know that the INMO cooperated very fully and were a key partner in the development of safe staffing levels for the acute services, and I would expect that they would be fully committed to developing similar models for the non-acute services.
Thank you, Mr. Walsh. I'm going to give Dr. Smith, sorry, I'm going to give you 1 minute, if you can, just maybe to respond.
Very quickly.
Not a question, but just be able to respond.
Yeah, just to say, Mr. Walsh, if you can't answer my question about the change in regulations of the requirements of the professionalism of the person in charge, who made the change and when? What minister, what department, who in the department? If you can't answer it now, will you please find out the answer and give it to me? It's referred to in the expert report, so I'm surprised you don't have the answer. It's on page number 96 in chapter 7, and it's a very clear move away from having qualified, highly qualified people being in charge of the nursing homes and deregulating them to an extent that I think that it may show that patients who got sick suffered, and indeed residents as a whole suffered because of the reduction in the level of qualification of the PIC, as it's called, the person in charge. Why was that regulation changed, and by whom and when?
Thank you, Dr. I'll ask Mr. Walsh if you can provide a written response to that issue with the other issues as well.